As we know, the COVID-19 outbreak is an unprecedented crisis for our healthcare system and entire society, filled with uncertainty. There are many predictions we hear every day, but we really don't know exactly what's going to happen. Healthcare workers are in a particularly difficult position, especially those on the front lines of this crisis.
I worry about the number of ventilators that we have in Boston and the US, and that we're going to have to start rationing them.
I would be willing to be symptomatic from this if need be in order to take care of patients and try to help people survive if that's what it comes down to. But it's pretty scary, I have to say.
We are so uncertain about how long this pandemic will last. I worry that people who are otherwise healthy will sort of tire of all of the social distancing efforts and lose a little bit of their vigilance, and that if that happens, that disease will spread again.
Because of this extraordinary, unprecedented situation, we have created a brief course that provides information and tools that might help some of us in the healthcare system manage some of the stress associated with this crisis. These tools have been shown to increase people's ability to handle stress and adversity. We want to encourage you to take some time to take care of yourself during this very difficult time, even if it's just for a few seconds an hour or a few minutes a day. Doing that will not only help you manage the challenges in front of you, but will be beneficial to everyone around you as well. We will deliver this course in short videos, which you can watch while you're on a break or have a few minutes to spare. Research has shown that in prior pandemics, higher rates of anxiety, depression, and other types of mental health problems occur in healthcare workers. We know from research studies that certain kinds of psychological tools or approaches can increase psychological well-being and help people weather highly stressful situations. Given this, we feel it's important to share these tools and information in case they might be helpful to some of us. We particularly want to do anything we can to support those who are not able to stay at home and work remotely, but are on the front lines of this crisis and making great sacrifices for all of our benefit.
Some of the stress we're experiencing comes from the understandable worries we have about what could happen and what the future will hold. This worry can be overwhelming at times. When you're in a moment of worry, thinking, when will this COVID-19 outbreak end, and how can I make it through the coming weeks, something to try is to take 3 slow, deep breaths. Focus on what your body's feeling. Start with your legs. Move to your stomach, then to your arms, your shoulders, then your jaw and your face. Try to focus your mind only on what you need to do in the next hour and perhaps the next several hours. If you can remember one concept from this segment, it would be 4 words. Stay in the day. Put one foot in front of the other until the day is over, and then do that again tomorrow. In the coming videos, we'll talk about some other techniques for handling stress and taking care of yourself during this time. Some of the best advice will come from colleagues like you who are in the same boat and trying to figure out how to handle this situation.
But I think for me, being on the front lines, it's important for me to reserve that energy and to try to make everything at home about relieving stress and relaxing and resting and recovering, because it's so stressful right now that the other half of my life needs to be just respite from that.
It's easy to get swept up in headlines and sound bits and to feel overwhelmed. But by reminding myself of things that I value, my family, generosity, kindness, helping other people, I get a sense of purpose and a sense of meaning, and I don't get swept up in all the things that I can't control as easily.
What relieves that panic for me is looking around at all of our very talented and smart colleagues who are providing leadership and clinical guidance during these times, and the fact that we are surrounded by such talented and capable folks really provides a sense of relief for me.
The tools we are going to talk about in this course are designed to increase psychological resilience. But what do we mean by the word resilience? There are many ways to define this, but most experts agree that resilience is a process of adapting well to stressful situations and bouncing back from, or even growing in the face of challenges. Resilience is not a fixed personality trait or ability. It is affected by the resources and supports in our environment, and also in the way we think about and approach challenging situations. And importantly, resilience can change and develop over time. Some of the things that have been shown in research studies to increase resilience include strong social connections, physical activity, a sense of purpose or meaning in life, spirituality and religion, community supports, and certain ways of experiencing the world around us and ourselves. And it's this last one that we will mainly focus on in this course.
Nurses are extremely resilient, and we are essentially each other's greatest allies. You know, no one understands my stressors, my frustrations, and my challenges than another nurse. You know, hearing stories of other nurses truly helps to keep me grounded. It also reminds me that I'm not alone.
It may be stressful to go to work and care for people that may be sick, that put me at risk, but I also remember how much these people need my help, and that gives me a great deal of satisfaction.
Prayer is probably the only thing that's been that helpful, and I'm not someone that prays all the time. I have to really set aside time to do it. Same with meditation. With prayer and meditation, I think it's important for me to focus on the things that bring me immediate relief, which are thinking about others, getting outside of myself, so praying for other people during this thing instead of just praying for myself has been really helpful, or praying for the ability to care for others, for God to give me, some strength to care for others. That's been the prayer that's given me the most peace.
Now, why don't you take a moment and think about what has helped you to be resilient during challenging times in the past? One of the biggest difficulties we're currently facing is the impact of social distancing and the closing of businesses and institutions. This can really interfere with the things we've all done in the past to maintain our resilience and well-being. Maybe you can no longer go to the gym or socialize with your friends the way you would have in the past. So let's think for a minute about what each of us can do despite these barriers. Ask yourself, are there still activities that are possible to do during this time? Like talking over FaceTime, reading, watching movies, maybe being in nature. Take a moment to think about things you can do that are fun, relaxing, or help you stay connected with the people you care about. Perhaps you can schedule at least one of these activities every day. No one has all the answers, but we can try to help one another by taking time each day to pay attention to ourselves and others.
Now we're going to talk about a simple thing we can do that's known to increase resilience. It's a way of experiencing the world around us and ourselves called mindfulness. There's a large body of research showing that mindfulness enhances well-being and psychological resilience. Also, brain imaging studies have shown that mindfulness practice leads to very positive effects on the brain. For example, mindfulness causes our brains to age less quickly. People who practice mindfulness over years actually have younger appearing, larger brains compared to others of similar age who haven't practiced mindfulness. So the bottom line is that there's a great deal of evidence showing that mindfulness is very good for your brain and your mental health.
A well-known expert in mindfulness, Jon Kabat-Zinn, describes mindfulness as paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. But what does that actually mean in practice? How do we do that? Many of us have the natural tendency to spend a lot of time thinking about past events, rewinding the day or the previous conversations. Or maybe we spend a lot of time thinking about what we need to do in the future, worrying about what's going to happen next. Mindfulness helps us stay grounded in the present. In fact, all of life occurs in the present moment, but we tend to live in our heads, cut off and isolated from the present moment and other people. For example, many schools are closed right now, and that's causing a whole host of challenges for families. Many of us are having to think about planning who will watch the kids and how will we occupy their time and energy while they're home. Those are important problems that have to be addressed. But perhaps there can also be room to find enjoyment in the extra time we may now have with our kids, or time we can spend with our family members or friends during this unusual circumstance. If we take a moment to notice and appreciate what's happening in the present moment, say as our coworker steps up and helps with a patient, or you listen to a funny story or have a great conversation with a friend, that's mindfulness.
We have a dog that we love very much, and taking him for walks has been really grounding and helpful because it's exercise and it's fresh air, and he doesn't know what's going on. And having a pet that depends on you and is there for you and is just warm and sweet has been really, really helpful through this.
I've been exercising a lot, which has always helped me in times of stress. Just trying to keep myself healthy, and it just gives me, an hour of time where I really don't think about anything else. I've been trying to refrain from social media. I've been spending a lot of time with my kids. We're getting outside, and that's been really helpful. Going for walks. We live in an area where there's really good mountain biking, so we've been doing that, and it's been great.
Here's a brief mindfulness exercise that we can try and that you can do almost any time, anywhere. Right now, let's invite ourselves to take a pause. If you can, you might sit in a comfortable position. If you're able, close your eyes or adopt a soft gaze. And bring your attention to your breath. How are you experiencing your breath in this moment? You might place one hand on your chest and one on your belly and simply feel your breathing. Notice how your belly rises as you breathe in and falls as you breathe out. You can imagine your lungs filling up like two upside-down balloons, the biggest expansion at the bottom. When your mind starts to wander, just bring yourself back to focusing on your breath. If it helps to create a focus, you might try counting your breaths. Stay here for a minute or more. And if you can, allow your body to let go just a little with each breath. When you're ready, you can open your eyes and let go of this brief practice. This is also something that you can try if you're a parent or caregiver with your child. You can sit or lay with your child, and you or they can put their hand or your hand on their chest and their belly, allowing them to also feel the rise and fall of their breath and come to a more calm, centered place.
It's important to remember that practicing mindfulness does not mean that you have to do it in a certain way. You don't have to sit in a lotus position and meditate alone for an hour each day. You can practice mindfulness anytime, anywhere. For example, while you're walking down the hospital hallway, notice the sensations of your legs moving and the texture of the walls. How many times have you walked through this hall and not noticed what was actually there? While you're brushing your teeth in the morning or night, ask yourself, what does it feel like to squeeze the toothpaste tube? How does the toothpaste taste? How do your arms, shoulders, and legs feel? There are many misconceptions about mindfulness. For example, mindfulness does not mean emptying your mind, trying to shake it out, or ignoring your problems, or even checking out. There is not one way to do it. You can do mindful breathing, walking, eating, communicating. It does not need to be a meditation. There is not a certain outcome you can expect. It doesn't necessarily mean you will feel calm, content, particularly not necessarily immediately in the moment. Some people notice strong emotions during periods of mindfulness, or even an initial increase in emotion. This is common. Over time, mindful practice will help you to manage strong emotions without reacting in a way that makes things worse.
During these times, the things I've done when I'm feeling stressed is just to go in my car and just take some deep breaths. I am fortunate enough to live in a neighborhood that has access to areas where I can walk freely and still be socially distancing myself. I just go out back in my yard and just sit and just take some deep breaths and just continue to think that I will be okay. I will be okay.
I wash my hands a lot. I use a lot of hand sanitizer. So just being more mindful about what I'm doing, about how long I'm washing my hands, not touching my face. The only thing I can really do at this point is try to prevent myself from getting it so I don't spread it. So that's kind of how I cope.
We just talked about ways to enhance your resilience and well-being during this stressful time. And one tool that might help with that, mindfulness, which is a way of staying aware of the present moment without judging what's happening or thinking a lot about the past or the future. Though mindfulness can be hard to remember to practice, simple things like taking a few deep breaths and noticing the details of what's happening around you can be done just for a few seconds. So let's pause for a moment to think. What can you take from what you've just heard, regardless of how small it may be? If you're thinking of trying out mindfulness, when can you do it and where?